my hands. Hi, I'm Jamie. I'm a student nurse. I'll be here to take care of you today. Can I please identify your name and date of birth? Then we do that. And then ask, how are you feeling? Do you have any pain today?
No pain.
Okay, so I'm going to do a head to toe. So basically, I'm just going to check everything out. We're going to work from the top going down. And if at any point anything hurts or is uncomfortable, we can go ahead and modify. And then I would ask, do you have to use the restroom before we start? Because I don't want to palpate on the bladder to get a pee. So close the curtain for privacy. And we're going to put the bed up and tall. And ask them if they've eaten right now, if they've had a bowel movement, usually just because there's a little bit of time. Okay. And ask them if they're comfortable, and then I take vitals first. So I always take vitals first. So then, okay, so we've taken vitals. I'm going to come over here. I have gloves on now. The patient's sitting up, they're breathing comfortably. So now I'm going to start head to toe. So I can take this off because my vitals are done. And we had good GI sounds, and my last bowel movement was today. So I go ahead and, I'll go through, but pulse ox, we've already done that. We're breathing on room air. So now we're going to come in, and I'm going to ask, do you have any psoriasis or eczema on your scalp? So, and I'm going to check the scalp. I'm going to feel to make sure it's normocephalic and there's no lumps, bumps, lacerations, anything like that I have to be aware of. So I'm going to come down, and I'm going to start looking up here and press against sinuses and ask if they have any pain with their sinuses or if they have any allergies. And that's going to remind me to look in the eyes. So I'm looking for Perla. So I'm coming this way, and I'm coming that way. And if they have really dark colored eyes, I'm going to darken the room because it's hard to see if they have really dark brown eyes. So pain, no. Pain up here, palpating underneath, asking about allergies or sinus issues. Come down here, have open and close the jaw, looking for like a TMJ or any kind of issues like that. So then coming up here, looking under the eyes, looking up the nose. I'm going to occlude one narrow at a time, make sure we can breathe and there's no deviated septum. And then we're coming down, and I'm looking the whole time at symmetry and any kind of facial droop, Bell's palsy, stroke, anything like that. And then we're going to go ahead and I'm going to look inside their mouth. And I'm looking to make sure that these are their natural teeth. And usually around this time, I say, do you have any dentures? Do you have any contacts? Do you have any hearing aids? Because we're up at the head. So then if they have the dentures, I want to make sure that they can eat normally. They're on a regular diet. So we go ahead and we check in there. Everything looks okay. Pen line away for a minute. Oh, and I want to look at the ears also as well. So when I come back and palpate, I'm going to peek in and make sure. So I'm coming down here. I'm looking to see if the trachea is midline and center. And then I'm also palpating carotid one at a time. So everything's good up here now. We're going to have you shrug your shoulders. That's okay. Everything feels okay there. Earlier I checked for presence of bruise. That was negative. Then I'm going to, I work down the core and then I do the extremities. So at this point I would check skin. I've already listened to heart and lung sounds. I think listen to ask about genitourinary and gastrointestinal, everything, So we know you're peeing okay, we know you're pooping okay, your heart sounds good, your lungs sound good, your skin's intact. I'm checking for turgor. I don't see any presence of any abnormalities with the skin. I'm feeling for temperature as I'm going down, and temperature's good, skin's dry, intact, warm. So then after this is done, I'm going to come down and check the perennial area. And again, just looking for anything, distension. Even though I've already listened, I like to double check because now we're more comfortable. And then checking if there's any kind of scars, like anything, C-section, tummy tuck, appendicitis, anything, to make sure there's no issues with that would throw off my assessment. So we're good there. We're going to come back up, and now I want to look to see, especially with the tattoo, any presence of stents or anything like that where I would not be able to take blood pressure, which I would have seen earlier, but I'm checking. And also any evidence if it's a female of they wear the sleeve, because things don't drain properly for the lymph nodes, so I'm checking that as well. So I'm going to check under the arms, and then I'm going to move down. As I move down, I'm checking pulses, I'm checking brachial, I'm coming down and I'm checking radial, and I do that bilaterally to make sure that they're even and they're both strong. And then we're going to move to squeeze my hands. I'll hold both hands at one time. I'll push, pull, and make sure the strength is equal on both sides, but I don't degrade it, right? I don't degrade strength there. Okay, so then arms are good, skin's good, everything looks okay. So then we're gonna try and keep it modest and keep them covered. And then, those are nice frill. And then I'm gonna come down here, and once again, I'm gonna check femoral pulse if I need to, but usually I go right to here to popliteal and check those pulses. And I'm looking for any evidence of redness, warmth, blood clot kind of things I'm thinking. Really shiny skin with no hair growth on the legs. And just any abnormalities, like one leg shorter than the other, were you born like that, or is there a fracture? You know, something like that. So, and at the same time, always like, does this hurt, you know, all that. So then I want to come down and I'm going to check the pedal pulse on both. I'm going to, when I check cap refill here, I usually check cap refill here, so I just know. Then I want to make sure if like this leg's propped up wide, you know, and I want to check the heels and the bottom of the feet because maybe they have something where they can't have this foot touch and there's like a pressure sore or something. So I'm going to look at the bottom of the feet, between the toes. Yeah, cap refill, make sure everything's nice and pink. And then after that, I'm going to roll them and I'm going to check their back, check the buttocks, the thighs, everything on the back, and make sure everything's intact. And at that time, I would listen to my lung sounds in the back. And if I had any problems with my cardiac, then their chest wall would be closer. So I go ahead and double check that. And then really, I'm trying to think. Really, that's about it because we did range of motion. And when I'm down here, I can check for that. We haven't checked for reflexes really because we don't have the hammer, but we did learn in lab.
Yeah.
So usually it's more strength and range of motion and equal everything. And then I think that's basically it. The only other thing is as I'm speaking to them, I'll pick up. You know, do you know where you're at? Do you know what you're here? What holiday's next? Things of that nature. But really, that's pretty much it.
Okay, and then what do you want to do before you leave the room?
So before I leave, I'm going to return the bed to a safe position, make sure they have their call bell. I usually say, are you sure you don't need to go to the bathroom? Because now they're more comfortable, they'll tell me. And then I'll make sure they're covered up, because it's always cold. And get them a drink if they need it, lower their bed, ask them if they need anything because I have the time, and make sure they have their remote and everything in place. And